For today's video series, I'm going to be discussing aid in attendance, more specifically that is special monthly compensation or special monthly pension. So what I'll do first is define what aid in attendance is for you. Then I'm going to explain how you can apply for aid in attendance benefits. I'm going to go through the regulations for aid in attendance, and then lastly, I'll discuss an aid in attendance examination form with you. So first things first, what is aid in attendance? Aid in attendance is a medical circumstance that veterans face when they require regular care from another person to carry out their ADLs, what's activities of daily living. So in this case here, it would be a veteran who struggles, for example, to bathe, dress himself, feed himself, cook for himself. Those are ADLs. And so aid in attendance is saying that they need assistance with those activities of daily living. A veteran can apply for aid in attendance in one of two ways. A veteran can apply for an enhanced pension or special monthly compensation. So the important thing to know here is special monthly compensation pays significantly more. However, there's a higher evidential burden. The conditions that cause the veteran to not be able to carry out his activities of daily living must be service connected for special monthly compensation. Whereas a enhanced pension or a VA enhanced pension, you do not need those service connected. So for example, if he has a heart condition that's not service connected and that causes him to the inability to dress or feed himself, that would be fine for the enhanced pension, but for the service special monthly compensation, he would need that heart condition service connected to get a special monthly compensation for aid in attendance. So that's just defining the difference between the enhanced pension and special monthly compensation. Both the same standard that the veteran cannot carry out activities of daily living. The difference there is the condition service connected that's causing that inability to carry out those activities of daily living. So that's defining aid in attendance for you. What I'm going to do now is I'm going to move on to how to apply for aid in attendance. So how to apply for aid in attendance, a veteran will need to complete VA Form 212680. That needs to be completed and mailed to the VA Pension Management Center to apply for aid in attendance benefits. Alternatively, if you don't want to mail the form to the VA, what you can do is go to your local VA regional office and apply in person. Again, below the video, you'll see links to both the form itself and where to send it. That's your VA Pension Management Center because there's different locations depending on where you are in the United States. So that's explaining how to apply for aid in attendance benefits. I defined what it is. What I'm going to do now is move over to the regulations. So the regulations that are applicable for aid in attendance is 38 CFR 3.352, the criteria for determining need for aid in attendance and permanently bedridden. You'll see here, it's a fairly long paragraph, but what basically this paragraph goes through is the stuff I already discussed earlier, the activities of daily living. Is a veteran capable of dressing or undressing himself? Is he capable of keeping himself clean and presentable? Can he shave and brush his teeth? Is he able to feed himself? Is he able to tend to the wants of nature? That would simply be, does he have to wear a diaper, a colostomy bag, something like this? Does he have urinary leakage or avoiding dysfunction due to, for example, maybe it's residuals of prostate cancer, these kind of things. These are the factors they're going to consider in the regulation here, 38 CFR section 3.352. The other factors they'll consider too is also, can he protect himself from his daily environment? Maybe he has dementia, maybe he forgets where he is, maybe he forgets that he leaves the oven on, maybe he forgot to take his medication. These are all relevant factors. The VA must answer and address all these factors before making the determination, is the veteran entitled to aid and attendance benefits, whether that's for the enhanced pension or special monthly compensation. So that's the relevant regulation. What I'm going to do now is, I previously talked about the veteran having to complete and mail in the VA Form 212680. So I'm going to go through that form with you today. So this form is fairly straightforward. Basically, the first sections can be completed by the veteran, or in the case of he's not, it could be the wife, the child, anything like that. We'll complete section 1, section 2, and section 3. Section 3 is important here, but section 3 is, again, like I said earlier, is he going for special monthly compensation or a special monthly pension, an enhanced pension? And again, that'll depend on what service-connected conditions you have, and are those the conditions responsible for your inability to perform activities of daily living. Section 4 here is just stating if he's hospitalized, is he in a medical institution or a medical facility. And section 5 is where you'll sign it. So again, the veteran usually signs it, but in the case of, it could be the veteran's spouse, maybe the veteran's spouse has power of attorney, then in which case she could sign it right there. Section 6, this gets over now to, it switches from the veteran, it actually switches to an examiner. So here is where, for example, you complete sections 1 to 5, you go to your family doctor, your family nurse, and you say, can you please complete this form here from section 6 onwards? And this is where your family doctor will write in what disabilities the veteran currently has, what are the significant symptoms, do these disabilities prevent him from, as here, the ADLs, as we were talking about earlier, and number 27 on this form, do they prevent him from bathing and showering, eating or feeding himself, or dressing, tending to his hygiene needs? So this is where the, your family doctor, your nurse, whoever you go, whatever medical professional you go to complete this form, will fill in these criterias. For example, if the veteran has a severe heart condition, maybe he can't, due to his heart failure symptoms, tend to certain needs like dressing himself or showering because it's too physically exerting or exhausting. And so that's what's going to be written here. Basically, the family doctor will be filling this in, saying due to coronary artery disease, he cannot tend to his basic activities of daily living, and he would check the appropriate boxes here. That's really everything to go through with you here. Essentially the first 5 sections you're going to be completing, that's you, the veteran, or for example, the veteran's spouse who has power of attorney can be completing the first 5 sections. And then section 6, 7, and 8 will be all the medical professionals. Once this is completed, you're going to take that and mail it to the pension center, as I previously discussed early in the video, the VA Pension Management Center. And again, those links are below this video if you want to click on those. It'll show you where the form is and where to send that form. Alright, so that's the end of my video today. If you look below the video, you'll find web links to the regulations, and you'll also find a link to the relevant DBQ. Also below the video, you can post any comments if you have any questions. That's everything I have for you today. Thanks. Bye.